Welcome back. In this week's Medical Center Health System Taking Care of You, we're getting answers to your questions concerning women's health issues. Dr. Avelino Garcia is with us. Take a look. We are back today with Dr. Avelino Garcia, an OBGYN at Medical Center Health System, and we have some questions from our viewers today. So we're going to get some frank answers about some topics that can be difficult to discuss, but we're just going to be nice and open. The first is a follow-up to the conversation that we had about urinary incontinence, and our viewer wants to know, is there something that you can do to strengthen the pelvic walls to help with that issue?
Yeah, there is some tips that you eventually could follow. There is some exercises, very simple exercises that are called Kegel exercises. Basically consist of trying to contract the pelvic muscles regularly. That can be done as many times a day as the patient wants, at any time, whenever she's walking, whenever she's driving, at any time during the day. And that will help to keep the tone of the muscles at the level of the pelvic floor. Also, it's really important for the patient not to gain too much weight, because that's going to press everything down, and basically the pelvic floor is going to be overstressed. Constipation, chronic bronchitis, those things we need to avoid in order to make this problem of pelvic relaxation less likely.
Okay, great. Thank you so much. Here's a question. Please ask the doctor about female dryness after menopause, not just during intimacy, but at all times. And you say this is a common question that you get.
Yeah, it's a very common complaint, and basically it's something that needs to be addressed, because whenever the skin of the vaginal canal gets atrophic and dry, that vaginal canal is more prone to infections and problems with painful intercourse. So some solutions to that problem basically are medications that we have available as topical estrogens. In patients who have no contraindications for that, then they can use topical estrogens. I'm very against doing any kind of vaginal douches, because that could aggravate the problem and cause more infections and symptoms.
We appreciate you all letting us know. Dr. Garcia says he will be available for us, so we will check back in with him periodically and try to get answers to your questions, because we know that we have someone we can trust here. So thank you, Doctor, very much.
My pleasure. Thank you.
If you have questions, be sure and email us at studio7@cbs7.com.